So basically here we can see, just focus on the anterior aspect. Here we can identify all the edges or all the part of the patella except your posterior side of the patella. So this is the base of patella, apex of patella, lateral and medial edges of the patella. If you talk about the tibia, so here is, we can identify very easily one bony landmark, that is your tibial tuberosity, which is the insertion point of your ligamentum patelli or patellar tendon. यहाँ पर स्ट्रॉन्ग लैंडमार्क होते हैं एंड कंप्लीट नी जॉइंट हैज इट्स ओन क्लिनिकल इंपॉर्टेंस. तो यहाँ पे तो बहुत लिमिटेड बोनी लैंडमार्क है, यहाँ पे अभी मसल्स और दूसरे सॉफ्ट टिश्यू के अटैचमेंट नहीं शो हो रहे हैं. तो जितना भी नी जॉइंट होता है पूरा का पूरा बहुत इंपॉर्टेंट होता है क्लिनिकल पॉइंट ऑफ व्यू से, वेदर द pathological condition is related to any kind of population. It may be your old age people, it may be related to the trauma, athletic injury. So almost all type of injuries or pathology is basically found around the knee joint. Now let's have a look here. Basically with this picture we can understand the attachment of, यहाँ पे बहुत ही लिमिटेड स्ट्रक्चर शो किए गए हैं एंड बेसिकली हेयर ओनली दोज स्ट्रक्चर आर रिप्रेजेंटेड बाय दिस पिक्चर which are easy to identify or which we can palpate. So you can see that at the proximal part of the patella, basically it found the attachment. Basically it is provide the attachment on the heads of the quadriceps. थोड़ा सा ऊपर की लोकेशन पे at the same point we can also palpate the suprapatellar bursa. So basically this is the location of suprapatellar bursa. So in case of inflammation only we can identify it. This is the location of your ligamentum patelli. Again, just below the apex of patella, it is the location of your infrapatellar bursa. And again, if your bursa is inflamed, then only we can identify or we can palpate this structure just below the apex of patella. The next structure is again the other end of the ligamentum patelli is basically found the attachment for the tibial tuberosity. In this figure we can also see the attachment of your location of your medial collateral ligament, and this is the attachment of your lateral collateral ligament. But we will discuss this palpation in lateral and medial palpation technique. So let's start with the anterior knee palpation. कौन कौन से स्ट्रक्चर हम एंटीरियर साइड में palpate कर सकते हैं and what should be the position of the patient and position of the therapist. So basically the anterior palpation, if you are going to identify bony landmark related to the anterior side of the knee or soft tissue landmark which are found for the anterior side of the knee, so what should be the position of patient? Prior to identification of rest of the landmark, I would like to discuss one condition that is called the joint effusion, and it is very important in case of knee joint. So, and for palpation of joint effusion around the knee is it has different starting position. First of all, if you want to identify the joint effusion, you have to position the patient in long sitting. जब पेशेंट एक्सटेंशन में आपका लिम्ब एक्सटेंशन में होता है तो क्या होता है कि all three aspects of the knee joint become tight. All three aspects means your medial side, all the medial attachment of soft tissue and muscles become tight. Lateral also, posterior is remain extremely tightness. So what will happen? What will happen? Basically, जब आपका तीनों एस्पेक्ट टाइट हो जाता है तो ऑटोमेटिकली इन केस ऑफ जॉइंट डिफ्यूजन जो फ्लूइड होता है दैट ऑल कम फॉर द एंटीरियर साइड, आपके नी के एंटीरियर साइड में आ जाता है. एंड फॉर एक्यूमुलेशन ऑफ फ्लूइड basically this should be the position or identification of or palpation of joint diffusion. You can see that limb is in extended position. One hand is supported just distal to the joint line, means you have to make a grip like this to restrict or to obstruct the fluid which is going in downward direction. तो एक आपका हैंड जो डिस्टल साइड में होगा जस्ट डिस्टल टू द जॉइंट लाइन, नी जॉइंट लाइन. Another hand is placed like this, but prior to the placing your palpating hand like this, first of all you have to stroke over the quadriceps. Means आपको 2-3 बार उसके ऊपर से थोड़ा सा फर्म प्रेशर के साथ में आपको स्लाइड करना है टुवर्ड द नी जॉइंट. क्या बेनिफिट है इसका कि जो रेस्ट ऑफ द फ्लूइड जो इधर उधर डिस्पर्स हुआ है वो सारा का सारा एंटीरियर नी के पास में आके एक्यूमुलेट हो जाता है. एंड देन you have to place or you have to tap over the patella like this. Means you have to tap with the finger over the patella, and this test is basically called dancing patella test or patella tap test. And you will feel same like a wooden block when you are putting it in the water or fluid and it start to float. If you tapping over that block, what will happen? It will go or it will dip inside, and when you remove the pressure automatically it will again float. तो सेम कंसिस्टेंसी ऐसे ही मिलेगी जब आपका जॉइंट डिफ्यूजन की कंडीशन होती है नी में. सो दिस टेस्ट इज कॉल्ड बेसिकली पटेलर टैप टेस्ट और डांसिंग पटेलर टेस्ट, बट इट इज लिटिल बिट डिफरेंट टू द palpation. It is the part of palpation. We can rule out this condition with the help of palpation, but it is not the structural palpation. Now come to next of the landmark, which is related to the bone or soft tissue. So here on the anterior side you can see in these 5 landmarks, 3 landmark is related to the patella. What are that? Base of patella, which is found proximally. Edges of patella, both sides, from the medial pole and from the lateral pole up to the apex of patella. So this is medial edge and lateral edge. Edges of patella. And next is apex. Your patella is basically located like a inverted triangle. तो उल्टा होता है, उल्टी पोजीशन में होती है जैसा कि कोई ट्रायंगल होता है, इन्वर्टेड पोजीशन में होता है. तो apex is found distally and the base is found in upward or proximal. The next landmark is your patellar ligament, and the last one is tibial tuberosity. So let's start for all these structure. For the palpation of all these structure, what should be the, again we have to discuss the starting position. So what should be the position? First of all, you have to place the patient in high sitting or sitting at the edge of a couch or treatment table. पहला आपको पोजीशन करना है. The thigh should be maximally relaxed and it should be supported over the couch, and your legs should be hanging over the edge. It should be free for moving. So let's start first. It's all about the starting position. First, the palpation of the base of the patella. What should be the position? Again, we have already discussed. Now come to the therapist position. For therapist should be positioned in front of the patient either side of the limb. It may be medial or lateral, but the most convenient position is the therapist should always remain at the lateral side. And you have to place your finger pad just proximally about 3 to 4 centimeter above the presumed location of the patella. Your knee should remain at the 90 degree, and you have to place your finger pad or forefinger just proximally to the base of the patella. The position should like this. So first of all, you have to place your hand like this, just proximally at the 3 to 4 centimeter proximally from the presumed location of the patella, and then passively you have to extend the knee. Why? What is the importance of performing this passive? Why not actively, or why not you ask to the patient to perform it actively? Because if patient is extended पैसिव करने का सेम वी हैव डिस्कस सेवरल टाइम कि आप पैसिव क्यों परफॉर्म करते हो. तो बेसिकली अगर पेशेंट एक्टिवली परफॉर्म करेगा नी एक्सटेंशन तो देयर विल बी कॉन्ट्रैक्शन ऑफ योर quadriceps muscle and that will interfere with your palpatory technique, means you will not be able to identify the clear cut margin of the base of the patella. So this will be the procedure. Just place your hand just proximally to the base of the patella, move the leg or knee in extension, grip the leg and move the knee in extension, and just try to feel the proximal end or your base of the patella, and you can mark it from medial to lateral or lateral to medial, means you can palpate complete base of the patella from medial to lateral or lateral to medial pole. Now come to the next, that is next structure, that is your apex of patella. पटेला palpate करने के apex of patella palpate करने से पहले we can also palpate the margin, medial and lateral margin of the patella. तो यहाँ पे दो प्रोसीजर है. फर्स्ट, either you can identify apex of patella with localization of ligamentum patelli. मतलब आपको फर्स्ट ऑफ ऑल आइडेंटिफाई करना है ligamentum patelli, and then you will proceed in upward direction and ultimately you will reach all the apex of patella. But यहाँ पे एक दूसरा मेथड है कि आपने मीडियल एंड लेटरल पोल पटेला का पूरा पाल्पेट कर लिया, एंड पे आ गए आप बेस ऑफ द पटेला के. अब आप फर्दर अगर पटेला की मार्जिन पाल्पेट करते हुए जाओगे तो इट इज डायरेक्टेड ऑब्लिकली इन डाउनवर्ड, मीन्स इट इज फ्रॉम, अगर आप मीडियल पोल से जा रहे हो तो इट इज डायरेक्टेड फ्रॉम मीडियल टू लेटरल, एंड अगर लेटरल से जा रहे हो तो it will directed from lateral to medial. So ultimately you will reach all the apex of patella. This is one of the method कि आप both margin identify करो and further patella का palpation करते हुए apex of patella पे आ सकते हो. Now another method, one more thing, prior to the palpation of rest of the bony and soft tissue landmark, we can also identify in this figure. You can see basically here is a line, one is horizontal, it is almost horizontal, basically it is representing the tibial plateau, and this oblique or curved line is representing the femoral condyle. So basically this is the joint space, and you can identify in flex knee, or when your knee is in 90 degree flexion, your joint opens up. तो यहाँ पे आप clear cut femoral condyle in proximal direction, you can palpate the femoral condyle, and distally you can palpate the tibial plateau, means you can ultimately feel the joint space just adjacent or at the level of your apex of patella. With the help of this joint space, we can identify the further structure which are found for the medial and lateral side. So I'll discuss in the when we will discuss the medial and lateral palpation of patella. Now, come to the again over the your apex of patella. So one method, as we discussed, identify the medial or lateral pole of the patella and further just follow it. Ultimately, you will reach over the apex of patella. Another method, you can see this white structure. Basically, it is representing the location of your ligamentum patelli. So just distal to this joint line. First, identify the joint line, both sides of the apex of patella, and then position your finger like this from lateral to medial or medial to lateral. You can perform from the both sides. तो जब आप lateral to medial आते हो तो you can identify the lateral margin of the ligamentum patelli, and when you come from medial to lateral you can identify the medial margin of the ligamentum patelli. So first of all identify the location, और एक थिक बैंड होता है, वाइड बैंड होता है. आप जब मार्जिन पाल्पेट करोगे तो कुछ ऐसे ही आपको वहां पे स्ट्रक्चर मिलेगा. तो फर्स्ट ऑफ ऑल यू हैव टू आइडेंटिफाई द लोकेशन ऑफ योर ligamentum patelli. Place your thumb pad over the first, mark the margin, then place your thumb pad over the ligamentum patelli somewhere here, and from here when you apply the firm pressure and slide your thumb pad in upward direction, so ultimately you will reach over the apex of patella. And in pathological condition, in any degenerative or inflammatory condition, one more structure we can identify or same location just below the apex of patella. Basically, this is the location for the your infrapatellar bursa. So you can also identify, in case of inflammation only, you can identify this structure, or you can palpate the inflamed bursa just below the apex of patella. So here we have two landmarks. One is apex of patella, that is providing the attachment of ligamentum patelli, and just below the apex of patella it is the location of your infrapatellar bursa. Again, return to the starting position means again you can place your thumb pad over the midsection of the ligamentum patelli and slide it down towards the leg. तो जब आप स्लाइड करोगे then you will ultimately reach over the a bony rounded structure. It is clear cut, very blunt or elevated bony prominence that can you palpate with circular palpatory technique. That is basically it is the distal attachment of ligamentum patelli, and it has its own clinical importance. There are going to be several conditions. One of the most common condition which is related to this structure is your jumper knee. So I think I have covered all the soft tissue and bony landmark which we can palpate in anterior section of the knee or anterior palpatory technique of the knee.